Welcome back to the channel. It's Unit 5, Part E.
Suppression of lactation. Suppression of lactation is nothing but stopping the production of milk. This condition is followed when the baby is born dead, that is after the delivery if the baby is dead, or mother is not willing to give breastfeeding, and the breastfeeding is contraindicated in the sense if the mother is having any immunological disorders or like AIDS, then the mother is advised to stop the breastfeeding. In this condition, the suppression lactation, that is stopping the production of milk, is done, and the drugs that are provided to stop the lactation is bromocriptine, or in the simple words Parodil. 2.5 mg it is provided orally morning and night, that is twice a day for 2 weeks continuously, and it stops the production of milk. And it also helps the return of ovulation. When the prolactin hormone is decreased, then automatically estrogen hormone and progesterone hormone is increased. Okay, so automatically ovulation will occur. Next, if this is not possible, then we will give ethylene estradiol 0.05 mg, and it is provided morning and night for 5 days. And there is another comboed treatment, that is combination of estrogen and testosterone prepared mexogen, and this injection is given IM after the delivery. Remember, this process is done to stop the production of milk. It is not done for every mother, and there are some other followings also followed, that is for mother we need to advise to stop the breastfeeding if the baby is alive, and even to not pump or excrete the milk from the breast, because after providing these drugs suddenly the milk never stops to produce. It will take time, no? So we, even at that time, even the milk is produced, she is not allowed to pump it. Okay, next, a tight compressed band around her chest, it is rolled around her chest. A tight band is covered, and it is for 2 to 3 days, and analgesic tablets are provided to get reliever from pain. This is suppressive of lactation, and do add your answer with your nursing care. Postpartum exercise, that is after the delivery you need to do few exercises to regain the muscle tone, to regain the strength in the muscles, and to get back the organs to the proper position. The first exercise is deep breathing. You have to advise the patient have to sit straightly and breathe deeply and slowly from the abdomen, mainly in the diaphragm. But mainly you advise the patient to breathe from the abdomen slowly and deeply, and repeat it to 5 to 10 times. And the second exercise is head and shoulder raising. The mother is advised to sleep straightly and do crunches. Crunches in the sense just lifting the head and touching her chest with the help of hands. Okay, you know how the crunches are performed in that way, but you have to sleep straightly. And this is advised to perform for 10 times. If possible, she can perform for 20 times. That's a good exercise. And next, leg rising. Leg rising in the sense the mother had to sleep straightly and lift her either one leg or two leg at a time. She had to raise the leg by inhaling and down by exhaling. This is leg raise exercise. This can be performed for 5 to 10 times. Next, pelvic tilt. This is nothing but the mother is advised to sleep like this, that is by bending her knees, and then by inhaling she had to lift her abdomen by bending her knee. This is her knee. By inhaling she is sleeping like this by bending her knees. By inhaling she have to lift her lower abdomen, and this is pelvic tilt, and this helps to strengthen the pelvic region. And next, sit-ups. Sit-ups is nothing but sitting and getting up. This can be performed in one day, actually 2 to 3 times in random time. It helps the pelvic organ to get into their original position. These are the postpartum exercises. Management of the discomforts in the puerperium period. Okay, at this time the main thing that is seen is after pain in the sense the pain after the delivery, and this pain is so vigorous in first 2 to 4 days. Okay, it is because at this time the contraction relaxation of uterus is constantly seen, and there will be a cut and blood clots also seen because of the delivery process. Because of those things, the pain is so vigorous in first 2 to 4 days. Even if you provide the medicine, still the pain can be seen. To get relief from this, we need to advise the patient to stay empty bladder. She need to empty her bladder whenever she feels full. Because of this, her pelvic will feel a bit relief, and after emptying her bladder, she need to place the pillow under the abdomen. Because of this, the contraction pressure will be reduced, and after this, if possible, she can massage her uterus. This is also helpful. And for the clothing factors, we will administrate ergometrin, and analgesic is also given to reduce the pain. These are the things that is followed to reduce the pain. That is, first we need to advise the patient to go empty bladder and place the pillow below our abdomen. If possible, provide massage for the uterus and administrate ergometrin and analgesic. Next, perineal pain. Perineal is nothing but perineal area, the area between vagina and anal. At this area, there will be a normal pain, and if episiotomy is provided, then she will have more pain. Infection is very common in this area. To reduce the swelling, numbness, we will provide the cold application. The cold application is provided by filling the ice in the rubber gloves, or ice bags is given for the patient, and she will place this ice bag in the perineal area. And Swiss bath is also very beneficial. And tropically ointments, that is anesthetic sprays or ointments, is given to apply over the perineal area to reduce the pain. But the most effective one is cold application. Next, constipation. Because of dehydration, the constipation is seen. For that, they will provide medicine, but mostly for many patients, they don't provide medicines. It is naturally curable. Apart from this, if the patient is having any other condition, like she has any breathing difficulties, you need to provide her oxygen, that is, you need to place her in ventilation. And if she has any other like abdomen pain or anything, you need to inform the doctor and follow those applications and follow those medications. Okay, with this, you need to add nursing care to complete your answer.
These are the questions from Unit 5. Practice well. Meet you in the next video. Until then, stay tuned. Bye.